Good morning, and thank you for joining us here on Chai Time. For those who are joining us for the first time, welcome. We are excited to have you. Breast health is an ongoing journey that involves awareness, health choices, and regular checkups. By staying proactive and informed, you can take control of your well-being and reduce potential risk. Today we have Dr. Federico Tozzi from Houston Methodist on Chai Time to help us have a better understanding on how to recognize changes and reduce risk factors through early detection and prevention. Dr. Tozzi is a surgical oncologist with Houston Methodist. His interest and dedication to cancer care matured over his early studies in medical school and postgraduate training, where he learned about the foundation of cancer biology and acquired the skills of cancer research. Good morning, Doctor. Welcome to Chai Time.
Oh, thank you. It's an honor to be here in this amazing setup and service you do for your audience in terms of, serving good information here for a healthy living and a healthy breast today.
Absolutely. Yes, we are really excited to dive in. We have a lot of questions, a lot of things to cover, especially for us women, right? We always put ourselves last. Many times it's always our family first and everything else. So it is nice that we are focusing on breast health, which is so important for us. And I'm just so glad that you're here to cover a whole vast of questions. So Doctor, let's begin with, recommendations for a healthy breast.
You're absolutely right. Breast cancer is one of the most common cancer in women. It's the highest incidence. 1 out of 8 women gets breast cancer in a lifetime, and also high mortality. As far as recommendation, in general, we consider plant-based diet rich in fruit, vegetables, and whole grain. I mean, there is not a magic food or magic diet, but we do have some evidence to help tailor our health habits. For example, what comes to my mind is, green tea. We have large epidemiologic studies, especially from Asia, suggesting the consumption of green tea reduces the risk of breast cancer. However, the data is not so robust that the doctors prescribe green tea on a daily consumption. The way I see this recommendation is, in the picture of your life habits. If you think about it, people who consume regular green tea are less likely to consume beverages like sodas or energy drinks. And it's often associated with the consumption of processed food. So likely if you are someone who consumes green tea regularly, you're more likely to have diet rich in fruits, vegetables, and whole grains.
Okay.
Another recommendation that I can give you is the regular consumption of olive oil. This is not considered another element of a healthy diet. There are large meta-analyses, which is a statistical scientific method to summarize the finding of multiple studies, very recent, that encourage the consumption of olive oil. It's beneficial in terms of cancer prevention in general, including breast cancer. Here the definition of healthy habits means that our consumption of olive oil is a result of food that is prepared from primary ingredients at home. This has the advantage of being healthier and fresher.
Bless you.
You choose ingredients with the option to select not just olive oil, but an extra virgin olive oil with no additives, which is in contrast with processed food and in general pre-made food, where you don't have any control of the olive oil that is used to prepare the meal.
So I just wanted to ask you, Doctor, so we use olive oil for cooking, right? In our salads, in our cooking, in our marinades. But recently, I don't know if this is true, but they say even if you drink olive oil, that is very beneficial as well. So I'm just curious about that.
I see your question and your point. Olive oil is used for cooking as any other vegetable oil or even animal-based oil. And the quality of olive oil in terms of antioxidant and the health benefit, it is decreased or null when you reach the boiling temperature. In other words, when you cook and it smokes out, at that point the antioxidant and the benefits of the olive oil is not there anymore. Therefore, we do encourage to use olive oil as a fresh food. In terms of consuming olive oil per se, like a couple spoons of olive oil a day. Currently, I don't have any evidence I don't have any evidence or know if olive oil consumed regularly in these terms has a decreased effect on breast cancer.
Oh, okay. All right. That's good to know. It's funny, sometimes when, and I guess, how it is with Google, right? Sometimes we're just like, or even with our feeds when we're on Facebook or any kind of social media platform, things pop up. So it's always, I'm always curious, right? And especially now, past for a few years, I've just been on this healthy diet and, healthy living, my overall health, because I'm in my 50s, so I got to be more proactive and things like that. And for me, I personally think I started a bit late, but, it's never late in some ways, so
Every
that's
moment
why.
is the right time to start something new.
Right.
We can, postpone and say, the New Year's comes, I'm going to change my diet, I'm going to change my life. I mean, true. I mean, also, within what you said, it becomes a habit, and it's a true habit. It doesn't have to be the ingredients per se, and that we consume, but also our eating habits. We live a busy life. We don't have a very established eating routine, many of us. We do have frequent snacks and what I call distracted eating. In other words, I gotta go eat something, or I am before the next shift, or I'm hungry during the shift, and you don't really focus on what you're eating. So sometimes you get off the chair where you've been eating eventually, and you say, I don't even know what I ate, but I'm not hungry anymore, and I can move on to the next task and responsibility.
Yeah.
It's interesting to see that it's becoming more and more popular. Some specific healthy habits like intermittent fasting, where the scientific community as well as the lay community noticed that intermittent fasting, which is scheduling abstaining from food for a period of time that goes 48 hours, has an impact on our aging, and considering that cancer is an aging process, also the intermittent fasting can help to reduce the risk of cancer.
Oh, okay.
And nonetheless, it's been shown also that it does have an effect on treatment of cancer, promoting a better outcome.
Okay, that's interesting. There's something new I learned today.
You're welcome.
Okay, so let's touch base on breast cancer screening. What are the current recommendations for breast cancer screening?
So when we look into breast cancer screening, our mind goes towards the mammography, eventually the ultrasound. I'd like to review with you these the merging of all the tools that we have to screen for breast cancer. In other words, what my message here is, screening is not limited to images, but also to awareness primarily, and have your primary care physician that can help you to identify what your personal risk is. The use of mammogram, it goes back to the last century, with the first part of the 20th century. A surgeon named Solomon, a German surgeon, started to study the breast tissue at the time of surgery with radiation. At that time, our success to to treat breast cancer was mediocre at best. But yet, from that challenge came the intuition and the thought that, well, what if we use images to identify cancer ahead of time? So here comes the use of mammogram first for detection of breast cancer, which is even today is not a perfect tool, and over the years evolved tremendously. But yet, it helps to identify tumor early on. There have been many large number of trials, 9 trials, I believe, that address the question of screening mammograms. And even we did not notice that there is a change in mortality, and we're referring this to the big numbers, like when we look at population studies, we do notice that it helps us early detection. And what is important to know is that the early detection of breast cancer translates into less aggressive treatments. In other words, many times we are in a situation to have a breast cancer that doesn't require chemotherapy, for instance, which is a toxic medication that we give to patient prior or after surgery to treat the breast cancer, or to avoid radiation in the elderly population. So there are tremendous advantage in early detection of breast cancer. And when it comes to the tools that we have, we mentioned mammography, also ultrasound, and in a specific population, MRI has been utilized for an early detection.
Okay.
When it comes to, when a question that I anticipate is when should we start to have our screening?
Yeah.
This being a mammogram association with an ultrasound. Well, it is a bit controversial, understanding that it's a topic sensitive. It's a sensitive topic to our science community, the medicine, and our patients. There are several guidelines, but in general, at the age of 40, or for some guidelines, the age of 45, every year or every other year, a mammogram should be part of your routine checkup.
Okay. So I'm just thinking, like, for me personally, when I was in my, I guess, late 30s, I didn't touch 40 yet, and my doctor did ultrasound. He didn't send me for a mammogram. So is it because of the age, or is it because...
Yeah, you're probably right there. That goes towards what we call in radiology breast density. In other words, younger a woman is, and the breast is more dense in terms of the amount of breast tissue within the volume of the breast, which is primarily adipose tissue. And so a dense breast, by rule, can obscure masses. So the mammogram is not as sensitive if you have a very dense breast, like in a young woman. Ultrasound has a benefit to increase the sensitivity in order to don't lose any suspicious finding or mass.
Oh, okay. That's good to know. I mean, I didn't even think of asking at that time, but I guess now with so much of awareness going on, and there's more talk about breast health or screening and all, I think a lot of women are now asking more questions to, their PCP or, the doctor, so that the more information they have, the more knowledge, it's more beneficial, right? So.
Yeah, absolutely. The way I present to my patients, they come with questions, or even when I discuss and review this with the primary care physician, which are at the forefront of answering the question and addressing the concern of patient, is there are three principles here. One is, the clinical breast exam,
okay, the
breast self-exam, and the breast cancer risk assessment. The clinical breast exam is the exam that you routinely have with your primary care physician or your gynecologist, done by a provider. And what has been noticed is that can detect cancer that was not prior detected. So early detection, you have the advantage of early detection. The breast self-exam is we invite women to have, to check their breasts with method that is taught by your primary care physician. And, that is not been shown to detect early breast cancer, but yet to be aware of your breast. So any changes triggers to be trigger to report to your primary care physician. And I think it's very important because if you consider that, you might have a family of breast cancer, either your mother, your sister, your grandmother, and knowing that it is very frequent, you might have been in a situation where, on avoidance, I don't even touch my breast, so I don't have to even to ask myself if there's any changes. And it's a very simple thing to do to indeed be aware. And so the awareness puts you in the mindset and obligation to report even to your to your family, or report to your primary care physician. So we do encourage a breast self-exam for personal awareness of your breast. And then lastly, we have the breast cancer risk calculators.
Okay.
The calculators allowed you to identify a personal risk for breast cancer. And factors that comes in these algorithms are your age, history or previous biopsy of the breast, family history of breast cancer or other associated cancer, like sometimes pancreas, prostate cancer, and your density of the breast. And we have these online calculators available for free that allows both the providers and the patient to have a number that puts you in a category of low risk or high risk. Low risk is, the general population, and the high risk if you have a risk of breast cancer more than 20%. And so with that number, we again encourage to identify what is a strategy for you for early detection. And this can be a simple mammogram, depending on your age. When the risk calculator has been used, like if in advanced age, perhaps a mammogram ultrasound is enough. But the risk calculators are sensitive even younger age, as young as 35 years old or 25 years old. And so with these calculators, we can customize and personalize the screening strategy that we can have with you in terms of, clinical exam, images, and nonetheless, as our conversation started on encouraging to have healthy habits, healthy food in your life.
So in terms of high risk, who is at high risk on getting, breast cancer?
High risk for breast cancer, if you have a family history of breast cancer in your first relatives, put you at high risk.
Okay.
If you have been exposed to radiation at early age, we call mental radiation for those patients that are at a young age, a pediatric age, had a history of lymphomas. And also a patient with a dense breast, or perhaps those patients that were found to have asymmetry on the breast or found in a mammogram, and this was followed by a biopsy to rule out cancer, and what we call this high-risk lesion. I'm not going to share the names because they're not going to give much of information here, but put your high risk for breast cancer. So if any of those are present, you review with your primary care physician and your radiology what this best strategy is. Not to exclude that we do have a knowledge of genetic mutations that can trigger breast cancer. You have to consider that 10 to 15% of the time we have familiar hereditary breast cancer. Now, we don't have a genetic reading, a genetic mutation in all these patients. Among these 10-15%, perhaps 5% have a genetic mutation that is associated with high risk of breast cancer. So in this category, the measures to prevent cancer can be not just frequent screening, but also prophylactic surgery to decrease the chance of future cancer, even mortality. I think the most common and the most common mutation that we find even in not just in the medical literature, but in the media, is the BRCA mutation. Those mutations increase the risk of breast cancer and also ovarian cancer and prostate cancer in men.
So what would you recommend as, like, for us when we go see our primary physician, right? What questions do you think as patients we should actually ask them when it comes to our health?
What is my risk of breast cancer? And unless you've already done your homework at home and find the calculators, which are available in any cancer association website, have the primary care physician help you to interpret these risk calculators.
Okay.
And then with that, you'll find a strategy. And again, if you see that you can have an improvement on your life by losing weight or introducing some protective food or exercise, that's definitely a recommendation that I can share with you.
Okay, that's great. So if one starts to do screening mammograms at the age of 40, in a lifetime a woman will undergo many mammograms. So can radiation exposure also increase the risk of breast cancer?
Yes, it's a very common, not that common, but it comes up here and there from my patients in clinic. Well, it is hard to determine, but there have been very sophisticated studies to estimate the number of cancers that you can trigger by these exposure to radiation. It is true, radiation can cause cancer, but when we do mammogram, the dose of radiation that we expose women to is very small. And the calculated number, hypothetical mostly, of cancer you can have is one cancer for 65 cancer detected. So, if you do cancer on 100 patients, you might have 66 cancers, and 65 were because you did the mammogram. The other one because you exposed a woman to years and years of radiation.
Okay, that's good. I wanted to also touch on birth control and hormone replacement therapy. So is there increased risk taking that?
When it comes to hormone replacement therapy, particularly estrogen, progesterone therapy, there is a slight risk of breast cancer, but the benefits in terms of how it benefits a woman the transition to menopause is it's very important to limit the symptoms and also the effect on their bones. So we do recommend hormonal replacement therapy, but with cautiousness.
Okay. All right. And so, doctor, are there any misconceptions when it comes breast health, breast cancer, that many people, sometimes we have conversations and we say, oh, this is good for you, or, we shouldn't do this this may increase breast cancer. Are there any myths or misconceptions that you could share with us?
None that I can think of. Unfortunately, we do know a lot about breast cancer, but know about what caused breast cancer, other than having this strong correlation that I mentioned earlier. In general, breast cancer is within the realm of cancers that we are at risk of, and therefore a general rule to healthy living, monitor your weight, and those are my best recommendations. So when it comes to breast cancer, I don't have a specific recommendation to decrease the personal chance of breast cancer. That's why screening mammograms and screening tools become very important, just to tailor your personal risk and take you off, the general risk of the population, or to be within the general population.
Okay. And if someone has breast cancer and they've done mastectomy, right? So will that eradicate the cancer itself totally, or walk us through that process when someone has done their surgery? What happens next?
So if you encounter a patient with cancer and the surgical treatment is a mastectomy, the lifetime risk of breast cancer is approximately 5 to 7%. And it sounds like controversial because you remove the breast. Why should there be a risk for cancer? Well, imagine that in the surgical act to remove the breast, we don't see all the breast tissue. You can only see breast tissue mixed to the adipose tissue under the microscope. So there's always some residual cancer there. Some residual breast tissue that eventually can decide to become cancerous. The way I present this to my patients is, intervention for breast cancer is not just to remove the cancer, but also decrease the chance of recurrence. And therefore, the chance of recurrence, depending on the biology of the cancer, can decrease with the same measures that we mentioned earlier, but also with treatments such endocrine therapy that decrease the chance of recurrence of 50%. So when it comes to the 5-7% I referred to, most likely this patient have mastectomy, as we mentioned, but also endocrine therapy for those tumors that are sensitive to endocrine therapy.
Okay. And is there any advancement now to prevention or to treatments as compared to previous years?
Absolutely. There's been the last 15-20 years enormous progress in the treatment of breast cancer. Now we do change now from preventing cancer, early screening to more advanced cancers. Chemotherapy has been pioneering new treatments with tremendous improvement of the outcome, especially for those cancer based on the biology to be deemed to be more aggressive. I can mention triple-negative breast cancer or HER2 positive breast cancer. Those are now treated with regimens that improve the outcome in terms of delay the recurrence and also improve mortality.
Okay, well, that's good to know. I guess Olivia was so engrossed in this conversation, she forgot to tell me go on break. All right, so we'll just go on a short break, and when we return, we will continue this conversation. This is Chai Time, 103.5 Hum FM. Welcome back to Chai Time on 103.5 Hum FM. We are in conversation with Dr. Tozzi, and we've been talking about breast health, and he's been sharing a wealth of information, and it's just been such a great topic to touch on, especially for us women, to raise the awareness of the importance of taking care of ourselves, of our breast, and really prioritizing our health. So let's continue with this conversation, Doctor. We were talking about how important it is for in different ways, right? And going back to actually the self-examination, do you want to elaborate a little bit about that as well?
Yeah, absolutely. I think the message that we really have to stress here is breast awareness. So invite to the self-breast exam and any finding to be addressed with your primary care physicians or following with a radiologist. These can create a situation of anxiety, of fear. It's also important to recognize that not all the breast masks are cancer. Oftentimes, especially in the younger population, those are benign conditions that don't necessarily need to be addressed with treatment or with these being medications or surgery. Sometimes we do have breast finding on mammograms that are considered to be suspicious. Even there, Not necessarily that means breast cancer. The next step is a biopsy. And a biopsy can be a benign biopsy, and therefore you go back to your routine screening mammogram schedule, like every year, or it can be a high-risk lesion, which means eventually the biopsy did not capture the early cancer. We're talking about early cancer here. Or is a question, or is questionable is within the area. The biopsy is a very small amount of tissue. There is cancer or a high-risk lesion, like I mentioned. High-risk lesion means that in your lifetime you have, depending which one it is, 3, 4, 5 times fold increase of breast cancer compared to the general population. And in this situation, we might want to do a surgical biopsy to have a larger specimen for the pathologist to review and clear if this is cancer or precancer condition only, a high-risk lesion. And there are, there are things we can do. There are endocrine therapy, for instance, that oftentimes is shown to decrease the chance in those patients to have cancer in a lifetime.
Okay.
But again, not all the findings, these being on physical exam or in mammography. A common situation is I have a call back from the mammography's clinic to repeat my images, to do further images. And we do. We are sensitive to call you for awareness, but also we have to remind you that not all the findings, either on exam or on images, represent cancer.
Okay. So other than cancer prevention measures and mammograms, what else should a woman be aware of for a healthy breast?
Here, I think, once we review the self-awareness, routine checkup with your primary care physician and your gynecologist for your women health, and at the time due, the screening mammogram and maintain your schedule. This is the best you can do to detect cancer early. And detecting cancer early represents on having less aggressive treatment for this eventual cancer that you had to deal with.
Okay. Now, in terms of getting back to initially when we were talking about our diet, right? Going into less processed food, eating, using the olive oil and the extra virgin olive oil and all of that. Does exercise also play a role in terms of, the healthy lifestyle?
Yes, absolutely. It's been shown that exercise is routine exercise. There are guidelines and consensus for 150 minutes per week of aerobic exercise. They can decrease the chance of cancer, breast cancer in general.
Okay.
It goes back to our initial consideration when I'm going to do this exercise and how can I get into the habit. It goes back to the healthy habit, right?
Yeah.
Oftentimes we see, the beginning of the year and the new sneakers to go running or to go to the gym. I always invite to a much simpler approach. Even if we don't think about it, but we have one of probably the best exercise available every day at every minute, which is walking. A vigorous walking to the store, to the market from your parking lot can be part of your exercise, and add on, you get to 150 minutes per week. So instead of parking by the door, I say park at the end of the parking lot and take your walk, take your fast walk to the store, and even if we think that is a shorter 5 minutes drive to the store, perhaps if you go to the store 3 times a week, if you don't have much of a grocery to purchase, take a walk from home.
Yeah.
So those are very small changes that we can do to have a good habit towards exercise.
Yeah, that's great advice because that's what I do. And some of my family members make fun of me when I park my car really far from the grocery store and they're like, why would you do that? I go, because I want to walk. I don't want to like just park, like closest next to the handicap parking. I just want to, like, why would I want to? And sometimes the closest parking always taken. And I find that people circle around and around and around. Why would you do that? Just go further away.
I totally agree with you. I love what you just said. It's totally within my conviction that it can make our life better. Yeah.
Absolutely. And I love the fact that you said about walking because, that we are so confined to being inside and just, it's nice, especially Houston weather. It's going to start getting really hot, right? So
yeah, we should take advantage of
yes.
those months of the year where the heat is not that bad and the humidity is not that bad. So let's go out and walk.
Yes, I love the fact that you mentioned that. And it's not only about preventing, like for breast health, but it's just the overall health. And we always say, go for a walk. And it's nice. It's a stress relief because we find like in this world now with technology and everyone on their device and there's so much of stress. And it's like people are just, like, what do they do, right? So just walking and there's such simple things that we forget. And, it's great that, so Dr. Tozzi is right, just follow his instructions. And, it's a great recommendation. So we've been talking about women, breast health, breast cancer for women. So can men get breast cancer?
Absolutely, you're right there. Accounting for approximately 1% of all the breast cancer diagnosed is diagnosed in males. There are familiar cases of male breast cancer, like I mentioned earlier in the BRCA mutation group, but also there are occupational risks like high temperature environments, endogenous high level of estrogens as a result of gonadal dysfunction, or liver dysfunction and obesity. Alcohol is also associated with high risk of breast cancer in the male population. Despite what is sometimes known and represent concern, gynecomastia, which is an enlargement of the breast tissue in men, and does not represent an increased risk of breast cancer in men. And just like we mentioned for the counterpart, for the women, we do have the same recommendation, such as, healthy life, no processed food consumption, and engaging in regular physical activities.
Okay, so men should just follow the same as what women in terms of...
We should extend our recommendation to our male fans here.
Okay. And we have a lot of male listeners. Sometimes it's astounding when I see the statistics that with our listeners we have more male listeners than female listeners, depending on, of course, the topic. I also wanted to touch on alcohol consumption, smoking. Does that also affect where it comes to healthy breast?
Well, I'm not aware of any study correlation between the incidence of breast cancer and smoking. There are in alcohol, but not in smoking. Yet,
Okay.
That being said, consider that in general, cancer, for instance, like lung cancer, is associated with smoking. You gotta consider that smoking you help your system to age faster, right? So our lifespan is increasing, and therefore, even in the circumstances that you are facing cancer, this being breast cancer, other cancer, your ability to to respond to the treatment and to overcome this obstacle it's related how you're fit to the cancer. In other words, if you have been a smoker for many years, which ultimately age faster your system, the cancer will find an older person than you really are to face cancer.
Okay, that's interesting. So before we wrap up, any final thoughts? I know you've given us a lot of information. We covered a lot, but to people who are listening, if there's one takeaway from this episode, what would that be?
I say, love your breasts and take the time to see your primary care physician. Embrace healthy living and schedule your next mammogram.
Awesome. Thank you so much for joining us this morning. It's been a pleasure. Yes, I've learned a lot. It's always an eye opener when we have professionals who come on air and share all different topics. And this one was so important, especially for us women. So thank you for taking the time, Doctor.
Thank you for the opportunity.
Thank you, listeners, for spending this hour with us. If you were unable to join for this informative discussion on breast health, please download our Chai Time podcast, which is available on Apple Podcasts and Spotify. You can listen to this and all other previous episodes. We would love you to share Chai Time podcast with your family and friends. Thank you for your love and support. Signing off, Chai Time on 103.5 Hum FM.